Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss the next part of the kinetic chain exercises, that is closed kinetic chain exercises. Closed kinetic chain exercises is when distal segment meets considerable external resistance, which prohibits free movement. So it is a system which neither the proximal nor distal segment can move. Movement in one segment in closed chain moves all the other joints predictably. Like during squat, the movement at knee joint accompanies the movement at the hip and ankle joint. So these exercises or closed chain exercises are exercises or movement where distal aspect of the extremity is fixed to an object that is stationary. With distal part fixed, movement at any one joint in the kinetic chain requires motion as well at the other joint in the kinetic chain. Therefore, both proximal and distal part receive resistance training at the same time. Eccentric contraction and co-contraction of the muscles are produced by closed kinetic chain exercises, and along with that the shear forces are reduced while adding comprehensive forces to the joint, which enhances the joint stability. So what are its characteristics? Like for example, when we are doing the squat, so there is a linear stress pattern which is produced at the tibiofemoral joint due to axial loading. So movement occurs at the multiple joint or multiple joint axes at the hip, knee and ankle and subtalar joint. Simultaneous movement occurs at both segments. Because of the simultaneous segmental movement, increase in muscular co-contraction is required to stabilize and control the movement across the joint in the chain. So increased comprehensive forces, congruency or decreased shear forces, decreased acceleration forces, stimulation of proprioceptor, large resistance force, enhanced dynamic stability. So what are the biomechanical or neurological factors? So basically the biomechanical factors in the closed chain kinetic exercises, it emphasizes on the sequential movement and placement of functionally related joint, therefore require the coordinated and sequential muscle activation pattern to control proper joint movement. And what are the neurophysiological closed kinetic chain exercises? Stimulate the proprioceptive system by proprioceptive feedback to initiate and control the muscle activation pattern. So these are some of the closed chain upper body kinetic exercises like push-ups, pull-ups, chin-ups or dips. So basically in these exercises there is co-contraction of the muscle groups like triceps brachii, biceps brachii, deltoid, pectoralis major minor, low back. So it basically depending on angle and leadage. So it is shown in the figure also. And in the lower body, the kinetic chain exercises include like squats, deadlift, lunges, leg presses. So in this there is co-contraction of muscle group like quads, hams, uh, hip flexor, soleus, gastrocnemius muscle, and there is movement at hip, knee and ankle joint. So basically example would be standing squat. As a closed kinetic chain exercises, during this exercise the feet remain fixed to ground and resistance is manifested by the surface as consequence of individual body weight and added weights in any form of dumbbells. Then joint approximation. Almost all muscle contraction have a compressive forces on joint surface and provide stability to the joint, whether open or closed chain situation. Joint approximation cause increase in joint congruency, which in turn contributes to the stability. So there is co-activation and dynamic stabilization, because these exercises stimulate the joint or muscle mechanoreceptor, which further co-activate the agonist antagonist and promote the dynamic stability. Also there is improvement in proprioception, kinesthetic awareness and neuromuscular control and balance, or we can say postural control. So it stimulate the mechanoreceptor in joint and muscle for enhancement or enhancing the sensory input for movement control, and also activate the multiple muscle around the various joints. So what we should consider, like in case of open kinetic chain exercises, These are the gravity assist. In open kinetic chain exercises in gravity assisted position may be necessary until muscle performance improves to functional level. And we should also consider the distal proximal segment when we are choosing the closed kinetic chain exercise. And closed kinetic chain after mobilization can be helpful to ensure the proper kinematics. Thank you.